dentist located an hour west of Toronto in Canada. And what I realized with my son's journey was he had sleep apnea, he had smaller jaws. And once we started putting all the pieces together, and started looking at the body as a whole, one of my osteo friends was like, Mandeep, your son's feet. And I'm like, what? What's wrong with them? I don't know. Like they're cute little feet, right? He was like 3 or 4.
Yeah.
And he's like, he's really, really flat footed. And I understand there's flat feet, some is okay. But he was really flat footed to the point where me and my husband were like, oh my God, does like his Achilles was like so twisted, like his heel was so twisted. We thought like, oh my God, is his foot broken? And I was so amazed. Like while we were expanding his upper jaw and his lower jaw, getting his sleep better, that his posture, he also had forward head posture was starting to change, but the forward head posture only started to change once we incorporated feet exercises. And
Mhm.
it was just a couple of months. Oh, it was during COVID. COVID, everything, we were allowed to do so much more because we were locked at home. It was during COVID that I was able to do those exercises religiously 3 times a day with him, and we saw massive changes. It was textured insoles, everything that you are all about, and that's how I came about you, because I was like, textured insoles, where do I get them here? How do I get them?
Yeah.
And then that's where I started connecting with you, and I wanted to learn more about the feet connection because they made such a huge impact for my son. So then after that, when I started treating patients, children and adults, I do full postural pictures. And they're like, I'm only here for straight teeth. I'm like, okay,
Mhm.
I know I'm going to be taking pictures here, but I need a full postural picture, front and back, and I want no shoes on because I want to see what their feet also look like. I'm
Yep.
not an expert, that's your expertise, but my job is I've learned enough to say, okay, you need a referral, you
Mhm.
need to go see somebody because I can't help you with your forward head posture and straight teeth, because people are like, I want straight teeth. Sure. Do you want straight teeth when your head's like this? Or do you want straight teeth when your head is back and you have a nice broad smile? Right? It's like you can't fix one structure if everything is off. And people think teeth are just separate from everything else.
Yep.
They're not. They're really interconnected to the maxilla, to all our cranial bones that affects our first vertebrate, which then therefore is a chain reaction,
Yep.
right? So anyway, that's my
I love it.
story in a
I
nutshell.
love it. I love it. So a lot of there might be a mix with the listeners as far as children versus adults. I know when we were speaking that I was very much, oh my gosh, thinking about myself
Yes.
because obviously I want to live as healthy and long as I can. But let's just talk about children for a moment.
Okay.
Why is it so important that parents think about the airway in their children, not just the teeth placement that might be the cue which tips them to explore your work, but just broad picture, why is the airway so important for children from babies to teenage, right? So that developmental
Right.
phase.
So, first of all, airway, we get first thing comes to mind, everybody's mind is oxygen.
Yeah.
Oxygen, oxygen, oxygen. So if your child is snoring, that is not a good sign. Not to scare you, it's okay. It's just that we are depriving our bodies, our brains, right? Remember, they're exponentially growing. That's why to me, children, I treat from 0 to 100,
Yeah.
right? So that's why I start treating babies, because they are growing exponentially. And if they have breathing issues at that young age, think about how we're hindering that growth potential. They're still going to grow if they're not hitting their genetic potential, is what I'm driving at. So think about oxygen. And now think about if their airway if it's not as big as it should be, our body is fantastic at compensating.
Mhm.
Your body is going to do, your brain, I should say, is going to do whatever it takes to get that oxygen. If that means forward head posture and a head tilt, it's going to do that. And that's what I see in children. That's how they sleep. They sleep with their head tilted, or they sleep with their bum in the air. They start changing their position of how they're sleeping. They're tossing and turning at nighttime. Or during the day, they sit there like this with their head forward completely. That goes for adults as well. We compensate, our body will compensate. And think of compensation as CPR now for a second. If somebody passed out and you perform CPR, what do? You do head tilt, chin up. You
Mhm.
open up the airway. Your
Mhm.
brain's doing that for you when you have forward head posture all the time.
Yeah, that's fascinating. So, and then obviously that affects learning.
It affects
which to me,
behavior.
that's what I think, behavior
Yes.
and learning,
Well,
right?
the thing about it, remember I alluded to it last time too, is you and I, we could get bad sleep, wake up, get our coffee, get our drinks, and be like, yeah, we're good to go. Children don't know better. They don't know that they're
Yeah.
tired. So some of them act out, some of them are sleepy, some of them act out in class. So it definitely affects their learning ability as well.
Yeah, that's important because I'm very sensitive to children being misclassified or things being labeled as something that they're not, where maybe it is just that the child is not getting enough sleep because of their airway. And, my field of space is maybe it's something also sensory that is kind of they just don't feel safe. And how do we connect to our feet sensorily? So it's very fascinating how complex it
Yeah.
is. So for the parents, let's say if their child is snoring
Yes.
and or maybe the teeth position is a certain way or they notice that their child is has a forward head position, where would they start? And the reason why I'm saying this is that we spoke about my daughter who ended up having adenoid surgery when she was 3, and now she's still snoring, so we have a conversation. Her pediatric dentist didn't say anything. So who do the parents look for really diving into this? Of
Yeah.
course, you, but
This is a hard one. This is the question I get asked all the time, like on my Instagram or emails I get all the time from parents, and I feel bad. Is you got to continue advocating for your child.
Mhm.
You keep advocating. Try to keep looking for that airway dentist, pediatric dentist. That's different than like an airway dentist,
Okay.
somebody that focuses on sleep. Like for me, when you come to my clinic as an airway dentist, I'm screening all my patients for sleep. Right? It's a quick questionnaire. Children or adults, you're getting screened. If you're not getting screened for sleep, they're not really an airway dentist. Those
Yeah.
are the kind of things you can look for. And then I started a movement called Heal, which you can find on my Instagram page as well. And this is a place for even patients or practitioners that are on here today that are looking to maybe build their own community. If they could be, it could be a chiro on here today or a physical therapist. It's like, yeah, you know what? I do have patients that have forward head posture or have sleep issues. I don't know who to send them to. You can go on to the Heal website and like there's a medical directory and you can find practitioners within your neighborhood. And I'm trying, it's still growing. It's in, the early stages,
Mhm.
but we have to start somewhere, start collaborating in healthcare for our patients because it's not going to be a one practitioner approach.
Got it. Got it. Okay. So my listeners are very, very aware of how I would be fixing feeds. So I don't want to dive into that because we have your expertise here. But let's say someone sees you as a patient and you identify that they have, I don't know, an improper tongue position or the palate is smaller, things like that. What are some of the most common interventions for this part of the body that you do? And then, of course, in addition to how you're looking at the feet.
Yeah. So the first thing I'll do is I got to see how they're breathing. Right? Where is that tongue? Let me start from the beginning again. Sorry. We got to understand why the jaw is small. Get to the
Okay.
root cause of what's happening. And it may, like you said, it may not always just be the face or something that's causing issues here from this area. That it could be stemming from other issues as well. But again, that's not my expertise. That's why I work and collaborate with other practitioners. But getting to the root cause is key. So if you have smaller jaw, you have crowded teeth, adult or children, we had to look at your oral function. Do you have a strong chin muscle? Do you have a very strong swallow where your tongue thrusts forward? What is your tongue doing? Are you tongue tied? Is your tongue restricted? And is your tongue not able to function the way it should be? So then are you recruiting other muscles? So a full assessment is key to understand the root cause. So if it is a tongue or oral facial muscle issue, meaning that, for instance, we can do a quick test right now. What's your swallow like? Everybody, we could do a big, big smile together and put your tongue right on what's called the end spot, right there. Big, big smile. And now try to swallow. It's very challenging for a lot of people.
Hmm.
So nothing on your face should move. Some people, their eyes blink. Some kids will be like, and they'll do like a
Mhm.
like their chin, their
Um,
neck would move because they're used to recruiting all these facial muscles just to swallow 2 to 3,000 times a day. That's how many times
wow,
you swallow. Think about you
fascinating.
lifting a weight at the gym. 2 to 3,000 times a day the wrong way.
Mhm.
You know what I mean? So think of the tongue as exactly the same. It just recruits other muscles if it can't work, if it's restricted.
Yeah.
So we work with what's called a tongue trainer. A myofunctional therapist is key in all my orthodontic treatment. I
Okay.
want to establish proper swallow, proper tongue function, and nasal breathing.
Okay.
And then what we'll do is either before or after, I can do what's called palatal expansion. I can expand the jaws laterally, forward as well. That's another missing thing that a lot of practitioners are not practicing right now is we're trained very quickly to do lateral expansion, but nobody's really growing the maxilla forward. Growing that maxilla forward is key for aesthetics, beautiful cheekbones, and less hollowness underneath the eyes. Because when this grows forward, aside from aesthetics, your lower jaw also comes forward. So you start getting that nice jawline as well. So aesthetics and
Mm.
function is key. So when you start saying stuff like my
Hmm.
chin is too far back,
Yeah.
well, your chin's too far back is not actually the issue. It's actually the maxilla is so far back that we need to bring the maxilla forward and then bring your mandible forward as well. So it goes hand in hand.
Wow. Fascinated. Now everyone who's listening, I know I am. I always get paranoid or
We're so
self-conscious.
beautiful. Oh my goodness.
Where I'm like, can I smile and swallow at the same time? Oh my God. I'll do that again later in the bathroom. Because I was looking at you when I did it and I was like, I didn't look at myself. Oh my gosh. So are these appliances that you're using like
There's
braces
so
or
many.
what
There's
are
so
they?
many different
Okay.
types. So there's like removable, there's fixed, there's ones that you and I talked about. There's so it's you know what you there's a lot. I have a lot of tools in my toolbox.
Okay.
It depends on where the patient's located, how frequently can they see me, how severe is the case. You know, we have some kids like we have talked about earlier, or even patients that are sensory. You can't give something rigid and really hard to a patient like that.
Mhm.
They have already so many sensory things that are going on. So you want to start gentle and small. And maybe we'll just start with nasal breathing, regulating that nervous system, working with the feet, working with the OT, working with the chiro, and then we can start with different modalities of expansion. There's just so many different ways to expand. And don't let anybody tell you one way is better than the other. The
Mhm.
one that's best for you is the one that your body accepts that's good for you.
Yeah, yeah. So this myofunctional
Mhm.
therapy, I'm very intrigued by this. Do you think that, I know that you said you're not a myofunctional therapist, but you work with a lot of them. Do you believe that it's something that every adult should integrate in part of their longevity story? Is just thinking about like the tongue and the face muscles?
Yeah. So if you are into like longevity, biohacking, and you want to age gracefully, if you have muscle imbalance, oh, my computer's about to die. Sorry, the light went off. If you have muscle imbalance,
Okay,
okay, on your face, I mean, you're using one side more than the other, that's where you get asymmetry.
okay.
Right? So if you're getting asymmetry in your face and you want to balance that, you got to balance the muscle. So that's
Yeah.
where oral myofunctional therapists come into play too. So you start getting these little jowl lines. A lot of women, like in their 40s or like, early 30s, even 40s, are starting to get these jowl lines like right in the corner. That's
Mhm.
because some of the muscles are so overactive, they're actually pulling down. The second reason could be because they don't have the bony structure that supports and lifts those muscles to give them that nice lift. So everything is starting to pull down because we end up losing our fat pads as we
Okay.
get older, like 35, 40, start losing that fat pad. So then we go to fillers and
Yeah,
injections,
yeah,
right? Which
yeah.
is, I'm not against, it's just we could delay that
Okay.
if we have the structure and the muscle to help us. Because remember, muscle dictates bone. So if you
Yeah.
don't have the right muscle balance, you're not going to have the right bone structure either.
Got it. So it is, and you're talking primarily face muscles. Can you talk about the tongue for a
hmm
moment?
So it would be the same. So what ends up happening is if your tongue isn't functioning the way it should be, you're recruiting your jaw muscle.
Okay.
And I'll give you an example. I do tongue tie releases on babies as young as 5 days
Okay.
old. Imagine a 5 day old little baby, okay? And I'm going in and doing an exam on this little baby. I can't even open that jaw on this baby who was tied right to the tip because
Mm.
for 3 months in utero, that baby used and overdeveloped this jaw muscle so much. Can you imagine that? A 5-day old. I don't think people can fathom that because it's even hard for me to picture a 5-day old sometimes.
Hmm.
I don't want to use that much strength to open that baby, but that baby that doesn't get the release is my adult now in their 40s and 50s. Like, my jaw muscles are so tight. It's because they compensated for all those years for the improper tongue function. Does that make sense?
Oh, yeah.
Right?
Yeah.
So you just learn to, the body just learned to compensate. That baby was going to survive. That baby was going to get the food that it needed through bottle or breast, right? I know breastfeeding is best, but some of us can't, which is okay. But that baby was going to compensate.
Hmm.
So, and they compensate from other muscles. So that's why tongue function is critical for facial development, but also for regulating the nervous system. You want the tongue on the roof of the mouth because there's so many amazing nerve innovations, like the vagus nerve as well.
Hmm. Hmm. So what is your belief around or your approach towards like teeth placement for the jaw? Should
Mhm.
they be open or not touching? I know that has to do with the vagus nerve and kind of how you stimulate it or
While they're
shift it into
resting,
a fight or flight. Yeah, in a resting position.
the, our teeth should only touch, are you ready for this? 10 minutes a day in
Oh
total.
my
And that's for when
God,
we're
hold on. You have
eating.
to say that again, Mandeep.
Okay, I'm not even lying. Your teeth, okay, should only touch a total of 10 minutes a day. That's because they're only supposed to touch while we're chewing our food.
Yes.
Okay, so I'm not saying walk around with your mouth wide open, but there should be just gently like this, not clenching hard. Okay, so that's really hard because I know a lot of patients that are not doing that. They're accelerating the wear on their teeth. I
Mhm.
have babies, children should never be grinding their teeth. If they're grinding their teeth, it's definitely a breathing issue because they're grinding their teeth, moving that jaw forward again, doing their own CPR, opening up their airway. Adults, grinding and clenching at nighttime is definitely sleep disordered breathing as well. So yeah, 10 minutes a day.
Mandeep, oh my God. I need to have you on longer. We have 2 minutes. Um, This is why I'm so glad that the world brought us together so we can do
I
some
me
stuff and
too.
help spread the message of the powerful connection and the importance of airway, which, I mean, breath is literally everything. But you're right, the body compensates for breathing, just like in our feet, the body will find a way to move.
Yes.
We will find a way to walk, right? Very inefficient, but we will
Yes.
find a way to walk. Um, so as we kind of like wrap up, because I know people's probably their brains are spinning and they're just fascinated and intrigued, which I hope. And if they didn't catch the whole thing, listen to it again, please. Um, but any last like tips, recommendations for the listeners, maybe it's as it relates to their children, to themselves about where to start? I mean, how do they know if they even need it as an adult, right? So just how do we get started in it?
I would say if you are, majority of people do clench and grind. Okay. If you're clenching, grinding, you got tight, like the masseter muscle, if it's like the cheeks are really tight, definitely be looking into connecting with the airway dentist or even a myofunctional therapist. Like you can DM me and I could direct you to a group of them. They're absolutely amazing. I would say majority of us do have oral dysfunction as well. Not everybody's tongue tied. Not
Mhm.
everybody needs airway orthodontics, but we do need that because we are all stressed out. We have poor posture. We our airways and jaws. I mean, we don't have time for this right now, but learning more about why are the jaws so much smaller? Like what happened? Looking at it from an evolutionary point of view, our jaws are getting smaller because of diet. We're not chewing enough
Mm,
food. Remember, I said our teeth are only supposed to touch for 10 minutes. It's not for soft food. We're actually supposed to have like hard food, fibrous food. It doesn't have to be meat. It could be vegetarian. It could be either or, but we need heavy. So I encourage visiting, even when you have a baby, go see an airway dentist so they can guide you on maybe baby led weaning. How do we get harder food into our child's diet so we can start stimulating the facial muscle growth, the facial growth in the right direction? But yeah, I wouldn't be too stressed out about it. I would just say DM me and I could direct you into the right direction, but definitely connect with the airway dentist and a myofunctional therapist.
amazing.
And
What
work
is,
with somebody that's going to do a whole body approach.
yeah,
Because remember, my results are tenfold by working with somebody like you for our patients.
yeah, yeah, there's definitely a connection. Now I'm starting to ask my patients who have flat feet about their breathing. So you've already inspired my work, and I have a patient that I need to send you. I actually am sending you. She was actually born with a cleft palate and has had a lot of reconstructive surgery because of her nose, her airway, her feet are like, and I told the mom that there's a powerful connection between them. So just a little nugget for everyone. I know you have a patient, but what is your website so people can follow you?
So they can come on my DM and it will lead them to my website. So I have heal for leadership, the number 4.com or familydentalguelph.com. So either or. But yeah, just connect with me here. It's just much easier so I can direct you to the right people. I don't want people just spending their money on consultations. I can direct you to the right person. And I had somebody just message me here too, that baby led weaning. Yes, I do refer patients to speech language pathologists and tons of different practitioners I work with. I'm sorry if I didn't mention all of them. There is just such a long
Yeah.
list,
Yeah.
but I do refer and work with quite a bit of different practitioners.
Okay, that's amazing, amazing. Thank you so much for your time.
Thank you.
My mind is blown. I'm gonna go do my smile swallow test now,
Okay,
and
let me
then
know.
and then remember that our teeth are only supposed to touch 10 minutes a day. To me,
Oh,
that was very fascinating. You have a very powerful message. Thank you so much
thank
for your
you.
time, and we will continue to work together so we can get our joint messages out and change people's lives.
I love it. Thank you so
Of
much. Bye,
course.
everybody.
Thank you. Thank you, everyone. Take care.